Hey y'all. For this month's Diversity and Inclusion presentation, we will be tackling the topic of BIPOC in medicine. BIPOC is an inclusive term that stands for Black, Indigenous, People of Color. We will primarily be talking about the life-threatening effects of racial disparities in healthcare, but there will also be discussion of more subtle issues in public health that have recently surfaced. Fair warning, I will be pulling information from certain real-life situations that may be disturbing to some, so please be advised of that and take care of yourself accordingly. Looking at the term medical racism, you may think that the issue is self-explanatory. However, a definition of medical racism derived from the YWCA describes it in more accurate depth. It includes both the racism in our society that makes Black people less healthy, the disparity in health coverage by race, and the biases held by healthcare workers against people of color in their care. This means that racism experienced in healthcare is not as surface level as it may seem, just like racism itself. It doesn't stop at a few doctors with slight race issues and bad takes. It affects people of color in their communities, the well-being of their families, and has and will continue to result in the loss of many lives for no good reason. This mistreatment presents itself in the three main ways mentioned above, and it's quite disturbing how they flow into each other. 1. The racism in our society that makes Black people less healthy can more specifically be called environmental racism. Environmental racism is simply the disproportionate impact of environmental hazards on people of color. Essentially, this is referring to the less than satisfactory living conditions that Black and Latino people are systematically forced into. Institutional decisions are often made to use land around areas highly concentrated with people of color to place receptacles for hazardous materials and toxic waste that can affect things such as air and water quality, leading to slowly deteriorating health. Because of this, it may seem pertinent that people of color living in areas like these have access to doctors, but that is not the case. 2. The disparity in health coverage by race is a pressing issue that is caused by systematic racism. Communities of color are often underserved in terms of government programs, and as a result, many people in these communities do not have health insurance and do not have the means to pay the high out-of-pocket costs that hospitals charge. Latinos are also more likely to avoid going to the doctor because of specific systematic issues such as language barriers and fear of their immigration status being revealed. This overall lack of coverage makes it harder for people of color to receive treatment in the first place. In the event that POC are able to make it to a doctor, their chances of getting actual help are slimmer than their white counterparts, due to number 3, biases held by healthcare workers against people of color in their care. Doctors are often not proficient in racial sensitivity and even think against it in some cases. For example, a study showed that an unsettling amount of medical students thought that Black people had thicker skin, meaning that they felt less pain than white people. This is a sentiment that has been demonstrated with multiple brutal displays in the past, such as early experiments with slave women done without their consent, the Tuskegee experiment, and the story of Henrietta Lacks. It is also common for Black women to not be listened to in regards to their own bodies, with medical professionals refusing to give pain medication or requested scans to certain patients. This also results in a higher than normal child mortality rate for Black women. Indigenous people in Canada also deal with this type of blatant disregard. The story of, excuse my pronunciation, Joyce Echaquan, and how she begged for nurses to acknowledge her allergy to morphine only to be met with insults and slurs, and Brian Sinclair, who was left untreated at an ER for 34 hours, come to mind. Both of these instances ended in death, and both were wholly avoidable. One of the last things that I want to touch on is the anti-Asian racism that has started to reveal itself in America. While there is not a deep history of medical malpractice against Asians, there has recently been a spike in anti-Asian rhetoric that has caused an uncomfortable divide in the intersection of public health and race. Historically, Asian people have been wrongfully accused of being vessels for disease. This is something that is rooted in racism. Sometimes it's hard to see this racism because of things like the model minority myth and the fact that hate against Asians is somewhat normalized and hasn't been a major talking point in the media. But it is very real. Due to COVID-19 and the handling of it by this nation's 45th president, there has been an easy target put on Asians in the past year. I don't feel like I have the authority to talk about this issue in great detail since I'm not a part of that group, But I do recognize the power of empathy and support in situations like this, and even just acknowledging the issue is the first step towards getting something done. Hopefully, this flow of information makes sense and leads you to the conclusion that none of this is coincidental, and that very few things in these systems are, especially considering all of the evidence that points to discrimination within them. I do urge you to do your research and begin to understand these issues in greater detail. You don't have to become an expert on them, but just acknowledge them. Knowledge is a burden, but it truly is power. Also, big thanks to Lambda Theta Alpha Latin Sorority for sharing their excellent presentation on this topic. I'm glad that we're able to have these conversations together. See y'all later.